Good evening, happy Wednesday, and welcome back to Health Plus Weekly. I am Dr. John Podkowa. I'm joined by my co-host, nurse practitioner Hannah Raymond, and we are excited for another great show. We'd like to welcome Joe Scott and Kathy Thornton, from Southcoast Occupational Health here to join us tonight. They are going to talk about injury prevention, kind of the scope and services that we have in occupational health at Southcoast, and also their ties to the community and the great services they offer locally in terms of schools and athletic training departments. We're going to talk about concussions and a host of other topics. As always, if you want to write in a question via Facebook, please do so. We're looking forward to an engaging show and answering not just our questions that Hannah and I have for them, but also your questions as well. So please send the questions in regarding the topics we're discussing, and if you have a general medical question, we'll take time to answer that at the end of the show as well. So with that, welcome guys. Thank you very much for coming.
Thanks for having us.
Thank you for having us.
Usually when we start the show, we like to ask our guests a little bit of background of how you wound up in this specialty and also what brought you to Southcoast.
I kind of fell into it in college. I was playing soccer, had a friend who was injured. I didn't know athletic training was actually a major. Spent some time in the athletic training room and fell in love with the profession and have been in it ever since. Nice. I've been down here since '89, working for Southcoast for the last 20 years. And I spent about 24 years at Bishop Stang High School as an outreach athletic trainer from Southcoast, and now spend some time at Dartmouth, as well as in-house at the hospital within our occupational health department.
Okay. Did you grow up around this area too?
I did not. I grew up in Quincy.
Okay.
So this is way out of my comfort zone when I moved down
Well, you've
here
left Quincy, so that's out of the
yes,
comfort zone,
yes,
right?
You're right, it is. Yep.
Joe, how about you?
So I've been a practicing athletic trainer now for almost 30 years. Actually, Kathy and I started together in 1989 in a privately owned physician physical therapy practice. Mm-hmm. I was the athletic trainer at Greater New Bedford Vocational for about 15 years before taking a leadership role within the hospital within our rehabilitation services department. Yep. Then about 4.5 years ago, I was asked to move over into our occupational health and employee health department to manage the ergonomics and injury prevention, both internally for our own South Coast employees and doing external outreach to many of the companies in our communities and providing services for them.
Oh, wow.
Okay. So that's kind of how my athletic training background led me into the injury prevention and the ergonomics part of it.
So what's the difference between an athletic training degree and like a physical therapy degree? What's the difference in training and...
Well, I mean, both professions have evolved a little bit differently over the past 10 to 15 years. Initially they were very, very similar. We're athletic trainers when we're a bachelor's degree, which they still are. Physical therapy has now moved to a doctorate degree.
Right,
so that's where some of the changes. But physical therapists deal primarily with basically the 5 major body parts and functions with individuals all ages, and athletic trainers specialize really in the sports medicine aspect, dealing with athletes of all ages, all types, all size, Special Olympians to geriatric athletes, youth to high school, college, professional sports. So their primary role is a preventative one, as well as acute injury care, emergency care, as well as the rehabilitation part of it, where the physical therapist role is primarily more the rehabilitation aspect of it.
So you kind of
big difference.
span the injury.
Yeah, we're one of the only professions that really see an injury from when it takes place on the field all the way through its course of action, whether it be going to orthopod, having surgery, having rehab, and then returning them to the field, because our goal ultimately is to return that athlete to the field better than they left. When they were injured. So,
and even prevention also.
And prevention is a very big part of it, yes.
Yeah, that's wonderful.
How many people work with you guys in terms of your teams, and where can people find you guys?
We have 10 area high schools that we contract with, that we provide the athletic trainers. So chances are, if you are in the South Coast area, you have a South Coast athletic trainer working within the high school setting. Okay. And then we also work within our occupational health department, in our clinics, and within the hospital itself doing ergonomics. However, in the hospital setting, we're injury prevention specialists. We use our athletic training background, but we're not practicing the same way.
Okay.
And in our health department, we have 4 providers. Dr. Damir Madligic is our medical director.
Sure.
And we have 4 nurse practitioners actually. And we work closely with many of the employee health nurse case managers, as well as the medical assistants and patient access reps, providing services, as I said, to both our own employees, 7,500 plus of them,
okay,
as well as over 500 community companies and industries that we provide different types of services for.
Wow.
Oh, so not just the hospitals.
Not just the
just
hospital.
kind of businesses can contract and get
Correct.
the occupational health
Our
services.
occupational health services really are primarily derived for outside,
Gotcha.
and it's the employee health services that are inside. So the occupational health is pre-employment screenings, DOT exams, workers' comp injury management, prevention, ergonomics, as Kathy said. We go on, we'll do worksite analysis, we'll do computer workstation evaluations. But it's really helping the companies to manage their own workers' comp cases, or work with them on a client basis to do annual physical exams or drug testing or audiology exams, respiratory testing. There's a lot of the stuff that's driven by OSHA, and OSHA regulations is what the local companies need to do.
As primary care, practitioners, Hannah and I, we like to start kind of in terms of prevention and preventing as much disease and injuries as possible. And so maybe let's start with at kind of high school, or do you work with children before high school, or is it you start really in high school?
We provide services to high school, but athletic trainers can work with
Yes.
youth groups, anything.
Okay.
They can work with anyone.
So tips, strategies for parents, young adults, to stay healthy and prevent some of the common injuries that you see. Can we start there in terms of?
Oh, absolutely.
You know.
I think, honestly, if you're talking about youth
Yes.
sports, I think diversifying their sports right now would be first and foremost. So many young athletes are now specializing, and they only play one sport, so they get no cross-training. So I think, honestly, that's one of our biggest issues in that particular age group, because they play baseball a year or softball a year or basketball.
Yeah.
They need to cross-train, and most experts...
How come? Like, what does that do?
I think it became, when the AAUs and some of the specialty teams came around, I think they decided it gave them a leg up, and I think in the past it used to. I think at one point in time when they were elite leagues, they used to, but now the market's so saturated with them, I don't know if it's actually giving people a leg up, or if they're just all ending up equal, but they're playing so much.
Okay.
But you're seeing, you shouldn't be seeing, for example, in baseball, you shouldn't be seeing 11 and 12-year-olds tearing their elbow ligaments, that ulnar collateral ligament. It just shouldn't happen at 11 or 12. And it's happening. If they didn't throw all the time, it may not.
And if they play different sports each season, like when I grew up, it was a similar thing. You use different muscles, I guess, right? And
Yeah,
so
they train everything when they play.
Skill acquisition for several different sports allow you to develop neurologically as well as physiologically the complete body. Whereas Kathy said, if you play just baseball or just basketball or just tennis, and you're repetitively stressing your body because that's all you do over and over again, your body's going to break down over time, even in young athletes, and probably even more prematurely. I think skill acquisition is really one of the most important things for young athletes, is before they even get into a contact sport or whether they're playing football or hockey or whatever it might be, that the skill acquisition is really most important to help them to develop both cognitively and physiologically, and get them to a place where, as they do get older and their body starts to develop and they start to get more involved in contact sports, they're able to handle the stresses of those types of sports, and that's a big part of injury prevention.
Have you seen? Did you have a question?
Go ahead. No.
A change in level of activities in children over the years of, perhaps less physical activity, more screen time, and then as they go into sports later on, are there more injuries, or the injuries about the same, or?
Depends what they're going into. I think because of the screen time and the sedentary, they spend so much time sitting. I think we see more low back in younger athletes than we ever used to.
Yeah.
Low back pain just because of the tight hip flexors, the tight hamstrings and things of that nature, for sure. I also think in some of the sports that are contact or very physical, mass dependent, I think you see some because they don't have the same level of strength. Because instead of running around for 6 or 8 hours a day developing their especially the lower extremities, they're sitting on the couch developing their thumbs. So I think that sometimes shows up within lower extremity injuries also.
Okay.
So for kind of younger children and teens and adolescents, Do you, in terms of injury prevention, do you cater to what sport they're going into, or is it just kind of general recommendations for everybody?
I mean, it can be both.
Yeah.
I think there's general principles that you can go by as far as activity level, stretching, cardiovascular strength. Those are the general things for preventive stuff. I think if you have an athlete that is specializing in a particular sport, then I think you can develop things specifically for them to help mediate some of the bad things that may happen from them, constantly stressing their body.
If they're not going to diversify.
Helping them to develop some muscles on the opposite side of their body, helping them to do different things to create a better balance with those types of things. So it's really kind of specific. I think getting back to Dr. Podkowa's question was, I think one of the most amazing things that I've noticed over the years and being here for a long time is with young athletes right now, if you go out and you watch young kids, look at the differences in them running. Some of them haven't even really developed the ability to run properly.
No kidding.
Their arms are all over the place, their legs are all over the place, their body, and a part of that is because they just never have started at an early age to do that, and they're not out doing that as much. So unless they've been involved in track and field at an early age, or they've been with somebody that has coached them on proper form and dynamics, it's amazing some of the things that you'll see out there. And you can tell, I think early in the season for any sport, when you're in the high schools, you can definitely tell the kids that are the more active kids that have been out doing things, and the kids that have been sitting on the couch all summer if it's a fall sport, because that first week of practice there's a huge difference in how they're acclimating to the sport and what they're able to do.
We talk about on the show just in terms of healthy and prevention tips of how important it is we are meant to move. Like fundamentally from an evolutionary standpoint, it's not too long ago that we were walking 8 to 10, 12 miles a day, and sitting in a way is, Runner's World had a great article years ago, like sitting is the new smoking, and that we really fundamentally do better cognitively, right? I think there's data linking inactivity to attention deficit disorder, that, if you are active, it helps you concentrate better, it helps you obviously kind of maintain your weight, core strength, because there's a component, and I don't know if you guys work with this in school too, with children, with some of this in terms of affecting their schoolwork and occupational therapy, right? In terms of how young children are developing executive function and in just how they're kind of making it through academic and sports curriculum.
Well, you even have had schools that have gone through kind of the wave where they've said, we're going to do away with physical education because, we don't find that it's a core part of their ability to learn. And then you have the people out there that are proactively saying that is the worst thing that you can do, because that is such an important part of the overall development of a child, especially at a young age. They need to move, they need to be active.
Motor skills, neurologic
those kids that do have like ADHD, that's even more important for them to be able to burn off some of that energy. So, I just think physical education in general has changed as well. And yes, the amount of inactivity, as we know. I mean, I have 2 teenage daughters, and the amount of time they spend on their phones, I can't even understand how you could do something for that long all day long. And I read an article not too long ago about the texting thumbs and
neck injuries, right? And
correct. So prevention is really, first of all, understanding and recognizing what it is that's going wrong, and then what can you do to help to prevent that from happening.
So can you talk a little bit about, you mentioned ergonomics. What is that? Why does it matter? How does it play into what you guys do each day?
So ergonomics is really the study of workplaces and the study of the human body fitting into the workplace. Too many times when we develop a workstation, we develop a workplace, it's unilateral, right? The equipment is the same, everybody puts in there. But all 4 of us sitting here are of different size and different shape. So ergonomics is really about fitting the workstation to the individual, not making that individual just fit into whatever workstation is available. So whether it's adaptive equipment that might be needed, whether it's making adjustments in a computer workstation, it really is kind of the science behind getting the human body to work most effectively and most productively with the least chance of injury in whatever work setting that they're in.
Okay.
Hold on, let me just fix my posture.
Exactly. Feet flat on the floor, your keyboard's too high.
That's right. And Kathy, you mentioned about workplace analysis. So did you actually go into the go into somebody's site if they're having a complaint, like a neck complaint or a wrist complaint, and kind of see what's going on?
Yeah, one of the things we have at Southcoast is any one of our employees can fill out an ergonomic evaluation request form.
Okay.
So we do it not only for computer workstations, but it might be somebody we've been to the lab, we've been into physical therapy parts, OT clinics, we've been in physicians' offices. Kitchen, yep,
Yeah.
all of those things, housekeeping. So we can go, if somebody is either just wants a request done, say they just got a new workstation, they'll move, and we go and we help set them up. We're looking at the proper positioning, how the computer's set up, the monitors, keyboards, things of that nature. If we're going into, say, housekeeping or the kitchen, we may be looking at what they're doing, what the setup is.
Gotcha.
For example, if someone is at the cash register, we may have to look how that's set up, or if they're within the kitchen itself, processing dishes or cooking food, we're looking, is it high, table high enough, and is it low enough? And we're looking at things that A, may have led to the complaints that they're having, or B, we're looking to try to minimize any particular behaviors that may increase the risk of repetitive musculoskeletal injury, which is usually what you see in this type of setting. It's doing something over and over and over again, eventually your body breaks down.
What are your most common complaints from kind of the...
Computers, it is probably wrists and shoulders and like upper neck,
yeah.
But it's because we sit like this all day.
Oh, yeah.
And we type, and people don't realize what we really need to do is we need to get ourselves into this type of a position. So a lot of times it's just, getting their computer set, their monitor set at the right height, their keyboard set at the right height, and then showing them some stretches so that they get themselves into that opened up position, in that opposite position. So for anyone out there, if you do this all day, or you're doing any one motion, you want to get yourself in the exact opposite motion to stretch those muscles, because tight muscles lead to injury.
How often would you recommend the stretch?
We suggest every hour.
Yep.
About 10 seconds, 15 seconds on a couple of different stretches. I tell people all the time to get up and do a couple of laps around their chair. It doesn't need to be fast. Even if you're on the phone, you can stand up while you're on the phone for 20 seconds, stretch your wrist a little bit maybe.
Yeah. It's amazing how you wind up like this. I mean, when I'm with patients and you're doing it, it's really awful. All of a sudden you're just...
Yes.
One of the biggest things.
Happen?
One of the biggest things we see is people just aren't. Again, we put a person in a chair and say, "There's your chair," rather than taking that chair and making it fit the person.
The person, right.
So one of the biggest things we see is somebody has a chair. It has all these adjustments that can actually make that chair fit. But a person sitting in a chair, not using the back of the chair, which is there to try and support them, right? Their feet are either crossed or up under the desk or wrapped around the other side, and they're like this and they're doing their work. And once we say, you know what, if you put that chair in and we adjust the back and your feet are flat on the floor and you're typing at an angle where your shoulders aren't being brought up here subconsciously because you're too high. Try that for a couple of days and let me know how you feel. And, I would say 90% of the people after a week say, oh my God, what a difference that makes. Because now your body is being supported while you're doing the work by the equipment that you have, and you're not supporting the body yourself the whole time. The interesting thing is Kathy and I, within the past week, have both figured out how to put an actual reminder on our own computer that pops up every hour. Time to take an ergo break. That's what we call them, ergo breaks.
All right.
So, it's just, okay, it's a reminder, you know what? Oh, I need to get up out of my chair and move a little bit, or I need to just stretch a little bit. As she said, when you're in a forward flex position, or whichever position you're working in during the course of the day, you want to work in the opposite. Yeah. So I tell people that electricians that work overhead all day, and they're always up doing this. I said, well, you don't want to stretch in that position. That's what you're doing all day long. You want to bring everything down. You want to stretch down in this position to relieve the stress on the muscles that have been on tension the whole time.
So we have actually a question that kind of pertains to this too from Anna. She has a strained scapula. She's tried everything: acupuncture, physical therapy, chiropractic, massage every other week. Nothing seems to help. She's had her workstation evaluated, and everything seems to be good from an ergonomic perspective. And she's wondering if you had any other recommendations for an additional step after the ergonomic evaluation's already been there.
Look, what a lot of people I've found when speaking with people at work who have been injured, you need to think about what you're doing at home. A lot of people don't realize that how you're sitting on your computer at home, even a bigger thing, how you watch television. Because if you turn your head one way, predominantly to watch television and you spend that time there, if your kitchen's set up so that everything is right side or left side dominant, so if the injury is on, say, the left side, if everything you're doing is left rotated, all those muscles are going to tighten up. Something as simple as the car. I've had employees that I've worked with who, when they sit in their car, they lean on their thing and they drive like this, and when they do that, that whole right side of their body becomes so tight, they now have pain. They've had everything done. We've seen them 3 times for ergonomic evaluations through job changes, and then when we sit down and have that discussion, they stop doing that and they prop themselves up and it solves their problem. So look at every
beyond
yeah, like it's not just
we promote
work.
tightness without realizing we promote it.
One of the things we see many times in truck drivers start complaining about leg pain, paresthesias, different types of problems. And come to find out, many times what it's caused by is putting their wallets in their back pocket.
That's happened to me, yes.
Right, and they're sitting on their wallet and they're causing compression on the nerve, and that's why you see a lot of, like, long haul drivers have the wallets that are on the chain. They're not really in their pockets, they're just kind of hanging there, so they're not putting that pressure on.
Yeah, that's the first thing I do when I get in the car for a long ride. I learned that when I was in medical school. An orthopedic surgeon said that is, take your wallet out and put it in the the center console or the glove box.
Right.
I learned that from George Costanza on Seinfeld.
Oh, yeah.
It's amazing we know from Seinfeld.
Yeah. What about pillows and sleeping? Is there any recommendations in terms of?
Again, everybody is built differently.
Yeah.
I mean, I can tell you personally that for a long time I used to sleep with 2 pillows. But I constantly would have like kind of neck pain and just not be comfortable. And then finally, I think in talking to actually one of the physical therapists I used to work with, they said, have you tried just sleeping with 1 pillow? I'm like, yeah, but I really like just try it. And I did, and I tried it after, and since I've gone to 1 pillow, I haven't had that same problem anymore. So yeah, it's different. Kathy made a great point, We seem to always have our spot on the couch where we watch TV or where we sit and use the laptop, and we get in that same exact position all the time, every night. So no matter what we're doing at work, we may be in perfect position and everything's good, but we leave the door and we get home and we completely forget about that stuff and we put ourselves into that position, and we may be there for as many hours as we were at work, if not more. And that's where a lot of those problems come in. So nothing specific, I think, for the scapula without being able to, actually put my hands on and see what's going on. But think about the things that the person is doing at home. Continue to do whatever strengthening exercises, because, again, usually any type of scapular pain is caused from forward shoulders or forward head. So you want to work in the opposite and work on strengthening the upper back and the muscles in your upper neck to try and take that tension off. And that's basically what I have for that.
How important is core strength and posture and kind of the scheme of your general,
Well, for me, it's probably not very important anymore. Is it helpful in general? Yes, because it helps to keep your body, again, in balance and in a good physiological balance. And for athletes, for young athletes, for even any type of competitive athlete, core strength is very, very important, because again, it's kind of the center of everything. So if you can be as strong as you want to be or could ever be for your arms and your legs, but if you've done nothing for your core to help support it, you are not using your body to the best of its own ability. I can remember growing up, guys that would be in the weight room constantly lifting, and all they would always lift, chest, arms, chest, arms, bench, so they were huge up here, and they had these 2 little strings hanging from their legs. So don't ask them to go out and run anywhere, but if you need them to pick up and throw something, it'd be great. But if they had developed their legs along with it, how much stronger would they have been? How much of a better athlete would they have been? So core stability, core strength, it should really be a part of anybody's training regimen if they want to be any type of an athlete.
And posture is very important, I think, more when you look at it that way, because when you think about it, as we explained to a lot of employers, I was explaining to one yesterday, is that when you change the angle of your spine, it changes everything up and down the chain. So by sagging and having a back that's rounded, it causes you to extend your neck. And it causes you to tilt your head. If you lean this way, it causes you to tilt your head to correct, because the simple way I explain it to patients and employees all the time, your eyes want to be on the horizon, and it will do whatever it has to get you there. So if below your eyes there is a change, it's going to adapt everything on the way up to get your eyes level. Gotcha. So what happens is it tends to put you in bad positions, whether it be athletically or work-wise, or even, when you're at home doing things around the house, your activities of daily living, it can put you in bad positions. So having good posture, not only sitting,
Right.
but standing, and when you're doing particular activities, having that nice straight spine, sitting upright, having that head in a nice neutral position is huge for preventing injuries, especially for anything you do repetitively.
I mean, one of the common things we see in the office, carpal tunnel. So broadly, if we could talk about things people can do to prevent work-related kind of, how do you prevent carpal tunnel? Is that something fair we can talk about?
I think so. I think the first thing to do is to recognize what causes carpal tunnel.
Okay, perfect. Let's
so
start there.
I think probably the most common analogy I hear that is, it's almost like if you're putting a kink in a water hose, right? So if you have a hose and it's nice and straight and the water's flowing through, it's great. But if you take that hose and you bend it, a lot of times it trickles out the end, or there's no water coming out at all. Well, the nerves that run through your carpal tunnel in your wrist work on a similar fashion, right? So they're firing, the muscles are firing through those nerves to allow for your hands to work properly. So if you keep a good neutral position and you're not putting any strain or stress on them, they're going to work fine. But when we get in a position where we're typing, let's say, and the biggest thing that I see when I go to the computer workstation is most people have their keyboards tilted in an up position. Okay, your keyboard should actually be flat. It should be like you're playing the piano. When you're typing on a keyboard, it should be like you're playing on a piano, and your elbow should be at 90 degrees or greater. Once you get your elbows up above 90 degrees and up here, everything comes up. So it causes tension in your shoulders, tension in your elbows, and then again with the keyboard elevated, now it's the tension in the wrists. You want to be in a neutral, relaxed position to relieve that stress. Repetitively, once you're in that position and you're constantly doing that, over time, and again, carpal tunnel isn't usually a one-time thing. It's something that's happening repetitively over time. So it's first recognizing those signs and symptoms. Oh, you know what? My hands feel a little funny.
Tingling,
or I got pins and needles. Or you go to pick up something to pinch it, and you're like, oh, I can't grab that coffee cup, or I can't pick that paper clip up. That right away should be telling you, okay, something's going on here, and that's where you should be looking at, okay, well, what's my setup? What am I doing? If you're somebody that works in a factory and you stitch all day, or you're a sewer, or you're a cutter. Sometimes those repetitive things are what are causing it. So, if you're a stitcher, maybe instead of stitching the same way all day, you need to go to the other side of the table and stitch from the opposite direction.
Great.
Or you need to do cutting instead of stitching for a part of the day. And that's a lot of the information we give when we go out to companies and we start to see, okay, what types of injuries you're having, what are you recognizing, why are they happening, do you have job shares, do you have the ability for them to be able to multitask during their jobs. You just can't expect somebody to sit there for 8 hours a day and do data entry or do stitching or do cutting or whatever it is, because over time, and for the first 10, 15, 20 years, they may be fine. But over time, the wear and tear, our bodies are like any type of machine. The wear and tear does happen from the friction, from the force, from all those things that are happening, and your body start to break down, and you start to get degenerative changes like arthritis. You start to get tendinopathies and inflammation and swelling, and those are the things that cause a carpal tunnel.
Now, those changes that people would make, is it in the workplace? So if somebody were trying to request, doing a different job for a period of time, is that covered under OSHA, so the workplace safety, or is it not mandated by law, and it would just be something that would have to be kind of negotiated?
There's a lot of information out there from OSHA on how to do it and do it successfully.
But they don't.
Each individual company can kind of make up their own rules or their regulations. Good companies will recognize when they have a certain job that is creating a problem, or if they start to get a certain amount of claims and it always coming from the same area. Hopefully they would look at it, or they'd call Kathy or I to come in and say, "Can you take a look at this and help us figure out what it is that's causing the problem?" And then we can make recommendations to them on what might be helpful to do that, whether it's job sharing, whether it's changing what they do. Maybe it's just their setup in general. Maybe the table's too high. Maybe they need to have something to rest a foot on to be able to switch their positionings. Maybe they need to go from a sit to stand position every half hour or an hour. There's so many things out there that can be done.
So employers, if they're not already working with you guys and who are watching tonight or the show, or employees, how do they get a hold of you guys? Like, how would they do? Is there a number they call? Is it on the website? Is it both?
We have, there's a Southcoast on the internet. If you go to southcoast.org, Occ Health,
Okay.
There's a whole website that talks about
it's OCC.
OCC, yep. All the information is there about what we do, what we provide. Our ergonomics and injury prevention office line is 508-973-9117.
Okay.
You can call, leave a message there if you're looking for specific information. Usually myself or Kathy or somebody will get back to you and answer those questions. And for any South Coast employees on the intranet, we have both an employee health and occupational health page that gives you information. You can also get a lot of information directly off the internet. You know, if you're talking about workstation evaluations or workstation setups, you can go on the internet and a lot of very good information out there that you can give little tip sheets that will help you to kind of, you know, make some adjustments yourself. A lot of it's just the educational part, I think. Kathy and I do a lot of education. It's not treatment, it's not hands-on, it's educating people on what the proper setup should be, what types of things they can do to prevent it. So a lot of prevention goes with being educational.
Right. We do have a question from Laura asking if there's help for employees that develop injuries as a result of their work. Can they, in your experience, can they take time off to recover and be covered under like a short-term disability type of?
Depends on the company, depends on whether they have short-term disability. But if it's a work injury, yes, it is normally something that if it's brought on by work, if it's brought on outside of work, every company has very different policies.
So it would be kind of individual, and they should contact the HR department.
Okay,
yep, great.
Yeah, and I will tell you that our recommendation for most of our providers is we hardly ever put anybody out of work unless absolutely they are hurt so badly that they can't. Studies show that, you know, keeping people involved, even if it's a modified duty for a certain period of time or a temporary job assignment, keep them active, keep them moving, allow them to do things. Those people tend to go on to get better faster with a better resolve than the people that are put out of work for an extended period of time. The longer they tend to be out of work, the less likelihood that they're going to ever return to work to the job that they've been in. So, you know, unless it's a very drastic case or somebody's been very severely injured, you know, we try and make those modifications or adapt the job so that they can at least return to do something and stay part of the workforce.
And it works out well for everyone because I spend time in the clinic working with patients for that. So.
Next, I think perhaps most common injury or work-related complaint I see, I'm not sure about you, Hannah, you know, low back pain. You know, maybe could we talk a little bit about, we've had guests on from physical therapy already talking about how, you know, how to prevent it, but I think it's worth revisiting if that's okay with you in terms of maybe preventing it and then also situations that, you know, to be kind of aware of that may help you or may put you at greater risk, and then also once it happens, you know, how do we get out of it and what to do?
For as far as prevention for a low back injury, what I see two big things: flexibility. People are very, very tight. Their hip flexors, those muscles on the whole front side of their body, their abdominal muscles are tight and weak most of the time. And the muscles on their back, so their glute, their butt muscles, their hamstrings are usually weak. So that imbalance a lot of times causes some abnormal pulling on their pelvis, I guess is a good way to put that. And it tugs on their pelvis so that it puts more pressure on the back. So my first thing would be to say is make sure that you are flexible. And I don't mean you need to touch the floor with your palms. I just mean you have to have normal flexibility. Core strength, as we talked about earlier, is important also, because when we think about it, our arms and our legs move on our pelvis, and if our core can't keep everything tight, our arms and our legs can't work properly. And then the other thing we see a lot of, it's positional, whether it be a patient coming in from another company that comes to see us in the clinic that I may see when working with the nurse practitioners over there, or even our own employees. If somebody is bent and sagging all day, bent like this at their computer all day, or if they're bent over doing the same thing in the same position all day, it's going to lead to pain even in the best of circumstances. So you need to work on, you know, modifying your position, making sure you're standing up straight, but making sure you're in that good position.
Again, that stretching every hour. I think it's a really important take-home message thing. For all of us, irrespective of what we're doing, I guess. Right? It's a good thing.
Correct.
Every hour, kind of reverse what you're doing. It's basically the take-home message, right?
I agree. And I think my take on the biggest preventable cause of back injury is, education. Handling materials and lifting equipment. We do whole lectures to companies on proper lifting techniques, and you would be surprised how many people out there don't know how to bend over and pick up a box, whether it weighs 5 pounds or 50 pounds. The first error many of them make is they don't know what the box weighs, but they go to try and pick it up the same way every time.
Yeah.
And there's a difference, right? If I'm picking up a 5-pound box, I can bend over without really bending my knees or flexing my hips and probably do that without much of a problem. But if I do it that same way over and over again, here comes the cumulative trauma, the repetitiveness of it,
Bam.
you're eventually going to wear it down. Now, if that's a 50-pound box and I don't know that, but I try and lift it that same way, there's a good chance you could herniate a disc or pull a muscle in your back or do those different things. So it's really, if somebody has a job that's very physical where they have to do a lot of lifting, carrying, pushing or pulling, it's educating them on how to get in the proper position, how to engage their core, how to be able to lift most effectively and most efficiently without causing more stress and strain on their body. Because again, whether it's in a proper workstation setup or whether it's lifting, it's doing it most efficiently with the least amount of stress and strain on your body. Certain jobs, certain things, you're going to always have stress and strain no matter what, but if you can lessen the amount and the impact, it's going to allow you to do that for a longer period of time without the ill effects.
I think we can transition now that we're all caught up on questions to something that you both are incredibly well versed in for a long time, which is concussions. So present probably to a small degree in the workplace, injuries that you see, but certainly in the athletic training world. Could you kind of talk, first of all, what is a concussion? We've heard a lot about it in the news recently, but what does that mean?
A concussion is basically a functional injury to the brain. So a lot of people equate it to a bruise on the brain, but I'm not so sure that's the best way anymore to explain it, because people can see bruises and you can feel bruises. But it's the way the impulses in the brain, the thoughts, the movement thoughts, things like that, get from one point to another. And that functionally gets disrupted. So at the cellular level, for some reason, the pathways aren't getting through. It's like putting a big pothole in the street. I say to a lot of people, the impulses still get there, the thoughts get there, but instead of driving from here to Boston up Route 93, it's like going 495. It gets there, but the thoughts and the impulses have to go the long way around because for some reason it's been disrupted. So it changes the way people can think, the way they can move sometimes. It can change symptoms. And the tough part about concussions is that they're so varied depending what part of the brain is impacted. Some athletes, for example, I had one athlete, the only symptom of a concussion was blurriness in one eye. It was the only symptom they had. Others may be dizzy and throwing up. Others may just have trouble sleeping, which is one of those symptoms that a lot of parents especially don't realize for kids is a huge symptom of concussion, is difficulty, either too much sleeping or too little, things of that. So because it's so varied like that, because it affects different parts, it can be a difficult thing to pick up.
What are some of the most common kind of impacts that you see, or like culprits for causing a concussion in sports?
Well, I think the most common misnomer is that a concussion happens because you're hitting the head. And that's not necessarily true, right? A concussion happens because your brain moves inside of your skull, whether it's a shearing or translational force, and that can happen from you falling and hitting the ground, and maybe you trying to prevent from hitting your head.
Right.
That can happen from a blow to the body, or that can happen from a direct focal shot to the head. Commonly we think of concussions associated with football. And, there's been a lot of information and study about wearing a football helmet to try and prevent concussions. Well, with what we know about concussions right now, you could have any type of helmet that you want. That's going to prevent a skull fracture or a skull injury. It's not going to prevent a concussion because it can't keep that brain from moving inside.
And how I always thought about it was, if you're traveling in a car at 40 miles an hour and you abruptly stop, your organs are also traveling at 40 miles an hour and they need to hit something to stop too. So in a kind of a modified way, your brain needs to stop.
And it's usually your skull that stops it. And normally it hits one side and then bounces and hits the other side, and you get a double injury on that type. But I think that the most difficult thing is, as much information that's out there and as much as we know about concussions, there's probably more that we don't know. And the studies are still going on, and there's more and more things that are happening related to the long-term effects and CTE and the different things that are happening with the brain banks and the studies of professional footballs. And it's scary. I spoke at the Wareham School Committee last month after 2 articles had come up, one on CTE being discovered in young athletes that supposedly had never had concussions, and the other one was about the FTA approving a
blood tests
for concussions.
Yeah.
And that was, as again I alluded to it, fake news, because it was a blood test for traumatic brain injury, which in some cases is also a concussion, but it's traumatic brain injury. We're talking about a whole other level of damage and significant injuries, bleeding on the brain, not something that we're going to be able to administer on the sidelines for a kid and say, okay, yep, you don't have a concussion, you're fine, you can go back and play. So they're very difficult. They're very difficult for us as athletic trainers. They're very difficult for physicians, for emergency room physicians, for primary care physicians. So I think having some rules and regulations and requirements in place on how we deal with them is our best approach right now, and trying to effectively manage them.
Why do we worry about concussions? Like the old school, like, oh, I was fine, I hit my head a bunch when I was a kid. But as parents, as people out there, why do we worry? What's the risk of not catching it, and what's the risk of not treating it, and why should people be aware of whether they have or their children or someone they love have a concussion, and how to go about taking care of it?
We worry about the big thing, the second impact syndrome that you hear, but if you read the literature, some physicians don't believe it actually occurs. They think it is, the injury occurs, but they don't call it second impact syndrome. But you worry about that catastrophic injury that happens post-injury. In other words, someone has a concussion and then they sustain another concussion too soon afterwards while they're still experiencing symptoms. They end up with a massive brain cerebral edema. They end up seriously impaired or unfortunately dead.
Okay.
That's the big thing that everyone worries. That is so few and far between, thank goodness.
Yeah.
But you worry about the long-term consequences. When you put an athlete back in that, let's just say they have a concussion and they have impaired reflexes, they might hurt something else.
Okay.
So that's one.
Not as sharp. They don't make the same
right,
decisions,
they're not going to make
right?
the same decisions. They could end up hurting their knee, their back. But we also worry about the cumulative. There are studies out there that show 2 concussions on top of each other. It elongates the time for them to recover. And what a lot of people don't realize, or I shouldn't say don't realize, don't think about, our children are students first. The most important thing they do is going to school and learning so that they can become functionally intelligent, productive part of society. And we've gotten lost somewhere that athletics is the most important, academics is second. So if you have someone who sustains 2 blows to the head, now they have to spend 6 weeks with limited learning because of symptoms. That's 6 weeks out of that child's life that they're not going to be learning what they need to be learning. And then they spend the next 4 months trying to catch up. It gives them added stress. It can lead to anxiety and things of that nature. So that's what we're really looking at rather than just the sudden impact syndrome.
Great point.
I think the most important thing to remember, to recognize is because the brain in young children and young athletes is in a developmental stage and it's developing very quickly, that the disruption that can occur and the cognitive effects long term, we don't really know. But one of the ironic things is when we're young and we get hurt and we sprain our ankle or we, break a bone, we heal very quickly, right? And when I'm 40 or 50 and I break that bone or I sprain my ankle, it might take me 6 weeks, 8 weeks, 12 weeks before I get better. Well, it's just the opposite as far as the brain. If I, at my age, hit my head and get a concussion, probably in 2 or 3 days, I'm going to be absolutely fine. But if I'm 14 or 13 years old and I do that, the brain doesn't heal as quickly in that young student because their brain is working so hard to try and develop and to try and mentally and cognitively develop that it takes a long time for it to recover and to get back to a normal state. And that's where I think the biggest concern should be with young athletes or young kids, especially kids that are prior to high school even, that get a concussion or get 2 concussions, because we don't know what effect that's going to have on their learning ability as they go on. And if they get several in high school, and they could have been a straight A high school student, and now they get into college and they're having troubles cognitively and problems learning, we don't know if that was potentially affected because of repetitive concussion syndrome.
So so it may not be a direct blow to the head. It may be just an impact, or maybe much more subtle than that. For parents, for athletes, for anyone really, because it can. I see it pretty frequently in primary care where I fell on the sidewalk or something. I bumped my head and didn't think anything of it. What are the symptoms that may be present but may not kind of scream concussion to people.
What I tell a lot of, especially high school parents, but it probably works for the middle schoolers too, is look for changes in behavior. The younger kids, so pre-middle school, a lot of times they can't explain or put into words what's going on. They'll say they don't feel right, they feel funny. Those are things. Anytime there's a blow to the head or a severe blow to the body, if they're telling you they don't feel right, something's off, I feel strange, automatically assume concussion until proven otherwise. For the teenagers and things like that, sometimes they're not going to tell you. They want to play, so they're going to hide the symptoms, and that's what we as athletic trainers with struggle. Concussions, I'm telling you, keep me up at night because I don't know for sure. Most of the time I'm working with athletes I know and see every day, so it's
you can
easier
tell
for me
the
to
subtle
tell in some
differences.
cases.
Yeah.
But for a parent point of view, we've caught some of them by talking to the parent. The parent says, I'm normally yelling at my kid to shut the music down. They're not listening to their music. Their kid's usually on the phone all the time. They're not on the phone. They're usually fighting with their parents. They're just agreeing to everything. So if there's a change in a behavior like that, when they're shying away from crowds, their friends, things that are noisy, television shows that flash, all of those things play into the symptoms such as visual disturbances, discomfort with increased noise, things that move too quick, they just can't process it will give them symptoms. The other is sleeping. But in a teenager, that's tough because teenagers' sleep habits are all over the place. But if you have a teenager that is all of a sudden sleeping far more than usual or far less than usual, they can't get to sleep. Those are two of the bigger things people don't realize, and even the kids don't realize until they're sitting there saying, I hit my head, I didn't think I had any symptoms, I never said anything, but I haven't been able to sleep for the last week and a half. So then you start looking into that. So those are the subtle things that you may not see. Then you have your normal headaches, dizziness, blurry visions, difficulty concentrating, the things that everybody picks up on. Yeah.
Emotional ability to get, is that like repeat?
Oh, you see, it's not uncommon to see a concussed athlete, whether it be male or female, they walk in crying, and you ask them why they're crying, and they look at you deadpan and say, I have no idea. I don't know.
My son and I recently had concussions. We, in a proud parenting moment, were go-karting indoors on we'll just say, we'll leave out the details, but my 11-year-old and I collided head on, and it's interesting in terms of we both had helmets on and seatbelts, but we both got concussions because of a deceleration, and it was interesting. I missed it in a way. We both didn't feel well. It was amazing, and I kind of give myself the fact that I probably had a concussion, that I didn't diagnose his concussion. But no, it was. And then Sunday night, he was just a mess, crying, and I was like, I was wondering about it, and still not putting the pieces together. But full disclosure, and then his teacher just called me. His teacher's great, and right away the next day was like, something's wrong with JJ. He can't get his work done. He's just staring at his paper, and the school nurse, and we got him and all of a sudden, it was kind of, I think Hannah overheard me talking and said I think you guys have concussions, And
then it clicked.
And then it kind of,
perfect. Well, that's a perfect example of what I was going to say. That probably parents know their kids the best, and second to the parents are probably the teachers. They are the ones that are going to first be able to identify that something's changed.
Something's on.
You have a student that actually has been a very good student, very attentive in class, very participative, and all of a sudden that changes. They just don't want to seem to be involved, or they're fogging out. Good teachers will recognize that, and that's why it's important. That's why we talk about concussion management in the high schools or even the middle school. It's not just about the school nurse or the athletic trainer. It has to be involvement with the parents, the coaches, the teachers, everybody, the guidance counselors, so that if it is recognized, so what do? How do you return to play is one thing, as Kathy said, but return to learn is actually even more important.
Okay.
So what do you do to try and integrate that student back into the classroom effectively, not so quickly that it prolongs their symptoms, but quickly enough that they don't miss 6 weeks of school because they've had these different types of problems.
And in your defense, the teacher probably had more symptoms to work with. As we know, what a lot of people say, someone gets hurt, let's say on Sunday night, they're fine, or they think they're fine. We know that concussion symptoms can take anywhere from 6 to 24 to 30 hours to develop because of the chemical processes that are going on in the brain. So somebody who may have been crying the day before, the next day, now the confusion sets in. But also what will happen, it's not uncommon to see an athlete hurt on a Friday night. They have a couple of symptoms. You see them on Saturday morning, they're fine. Their symptoms are gone all day Sunday because they're sitting on their couch doing nothing or just hanging out. Then they go to school on Monday, and now what's happening is their brain is being asked to do more while they're in school. And think about concussion, as I explained to everybody, it's an energy crisis. You don't have enough gas to run the brain. As the deficit gets bigger and bigger, the symptoms go up and up. So what happens is, if you're sitting in school and you need this much glucose to run your brain, and now all of a sudden you're tripling it because now you're doing math or whatever, the deficit goes from what you have to what you need, those symptoms get worse. So you see a lot of kids who go into academics the first day back, and their symptoms are in the nurse's office, they're nauseous, they have headaches, they're dizzy. And a lot of parents now don't believe their children sometimes because they think they're making it up because they don't want to go to school because they were fine on Saturday and Sunday. But their cognitive load was limited on Saturday and Sunday, whereas it's significant on Monday or back to school.
So kind of those seemingly abrupt onset of symptoms can be worrisome for parents and for us certainly. Kind of one of our main themes is always like when to worry. So those are pretty typical things and kind of but when should a parent worry, or when should a healthcare provider worry about someone who's had a concussion? Because we don't do a CAT scan on everybody.
And we shouldn't. Correct. Well, I think initially those immediate symptoms within the first hour to 4 to 6 hours, the nausea, the worsening headache, the blurred vision. Those types of things are the things to be most concerned about. And if that happens, that's when you need to get them to an emergency room or get them seen right away, because there could be something more going on functionally within the brain than you're aware of, or that's really presenting itself. But the more difficult ones are the 3 or 4 or 5 days later. Now we're getting more into the post-concussive type things. They're just not getting better. It's lingering. The headache's there. They're not eating normally. They still feel nauseous. Bright lights are bothering them. And it could take 7 to 10 days for that concussion really to resolve completely. But if it's not getting better each day and it continues, or it's getting worse, that's when I think it's important to get in and see the primary care physician or see yourself and say, okay, well, at least we're aware, we know where we're at, we can get a baseline now.
And then follow up.
Correct, and then go from there.
And most of the experts say at about that 3-week mark is when, if you as a primary care, like if you listen to some of the experts and read some of the data out there, they say at that 3-week mark is when they may change and start trying some different treatment strategies. So that's when they usually suggest that a primary care send them, or if personality changes and things like that are occurring.
And it's oftentimes neurology and neuropsych too for the behavioral changes, and to kind of to evaluate for any of those. So those would be the two main things. And I often send people for eye exams too if they have kind of persistent. Is there anything else beyond those kind of
Well, the other thing too that's often overlooked, especially if the impact or the injury was caused by a blow to the head or to the neck, is something going on cervically. That a lot of times they're still having symptoms, maybe a headache, maybe just just don't feel right. There could be something going on cervically. So sometimes going to physical therapy and having a cervical spine evaluated and looked at, sometimes there's some simple little exercise. Could be muscle tension.
To Kenny's point, to kind of expand the scope of what might be causing the problem.
Exactly. And then, or it might be if you have an athlete that's in one of our high schools, you can go see your athletic trainer also. They can take a look. Vestibular's the other. For somebody who has constant that they feel like they're a little bit off or a little bit of balance, sometimes they may need some vestibular training also. Luckily, in the adolescent age group, about 80% recover within that 14-day window. It's about 20%. They say about 10% have really prolonged symptoms. The other 10% are somewhere between that 3 weeks and 3 month mark. So that's the good thing. And if you read most of the experts, most, if not all, concussions do get better.
Great.
So that's the one good thing. It's just you don't want a concussion on top of a concussion. I've had 5 myself, and I'm telling you, it makes me a little nervous now and then when you read about it.
I don't know, you seem pretty sharp, so I think...
So recognizing the symptoms and just making the diagnosis and then getting to someone to treat. So whether maybe if they're in high school, reaching out to an athletic trainer, and then they might work with you guys, maybe pediatrician, or primary care doctor? Is there anywhere else to go for? Would they call your department directly, or what's the best way for athletes, young athletes, or young to where should they go?
We always encourage people early on. You need to see your primary care physician again because they have your medical history. They know you best. At that 3-week mark, 4-week mark, if it's prolonged, we do have a concussion management program at Southcoast. Dr. Dorn, who's the neuropsych physician, kind of heads that up, and some of the neurologists that work out of the brain and spine. They will see student athletes or pretty much anybody that have post-concussive syndrome, and they can do some more elaborate testing, neurocognitive testing, and really try and get a better idea of what is this? Is this a post-concussive syndrome, or is there something more going on? So I think that there's a number on the website for concussion management.
There is, if you look up concussion management on southcoast.org.
And then, so preventing another head injury, super important.
Huge.
Other kind of mainstays of treating a concussion are, I know you can't go through, but just generally, simply speaking.
Basically, academics, when you're going to school, the physician especially, but the parent and the child also, they need to work with the school. As Joe said, it needs to be a group effort, but it might be something gone are the days where it's go stay in a dark room for 3 days.
Okay.
But they've found that there needs to be an early return to learn, and now it's even an early return to activity, not sport, but activity. So something like walking or stretching facilitates recovery from concussion better. Figuring out in this particular school setting what works best. For example, someone can sit in a class for 30 minutes, but when they hit that 40-minute mark, they end up with symptoms. Rather than telling that kid just not to go to school, they stay for 30 minutes, they either put their head down on their desk or they go to the nurse's office for 10 minutes, then they go back to class rather than getting sent home to help increase their tolerance. That's the way concussion management is going. And their studies are starting to show it's helping kids get back in. And keeping an eye on when you do have somebody who has a concussion, an athlete, because it's an invisible injury, we quite frequently forget the mental health aspect of this, depression and anxiety, kids being removed from their activities that they love to do, removed from their friends, removed from their academics, and even bigger if they're an athlete, they're removed from their sport, so sometimes their identity, how they identify themselves is removed. So we need to be cognizant of that, not write that off, and you work with that part of it too. Because some of these kids, if you're somebody who's a straight A student and needs to be out for 3 weeks or limited, they're having a fit that they're going to be behind and they're not going to pass, their AP testing, or they're not going to do well in their SATs. So those are just some of the things we need to work with the schools on. And the parents really need to be involved with the schools too, because this is an ongoing and evolving science still. So everyone needs to be involved.
Okay, great.
Are we ready for the lightning round of concussion questions
Let's
at the
go.
end? Okay.
Fire away.
Okay, buzzers ready? Okay. A question from Laura. Is there any sort of prevention for a child playing baseball that parents should be aware of to prevent concussion, such as wearing a helmet, not just when batting, when on base? Is there any kind of basis for that?
Well, again, I think not so much for concussion, but for protection of your skull. Wearing a helmet is a good idea. I know in softball, for instance, now most pitchers and most third basemen are now also wearing a face shield with a helmet when they're to prevent from getting hit. That's not so much to prevent the concussions, but some of the other traumatic injuries that can happen. I think in concussion prevention, one of the biggest things and one of the big pushes you're hearing now from a lot of the experts is it's really about, at young age, skill acquisition for athletes and letting them physically mature and develop. So they should be maybe 13 or 14 years old before they start to get into some of these high contact sports. So youth football, youth hockey, even soccer to some extent, where there's a lot of physical contact and activity, and their bodies have not physically matured enough to be able to protect themselves. Again, we talked about the fact that the head slopping around is what causes it. Well, if you're 9 years old and you're not physically mature, skeletally mature, you don't have the ability to even really protect yourself as well. So that minor blow to the body may cause more of a whiplash
from
injury.
a 9-year-old that is developed.
Exactly. Or from an 11-year-old against a 9-year-old, the bigger size differences. So we can still develop as an athlete in any sport and develop skills without actually having that contact part of it. And as we find more and more about repetitive head injury and contact and more things come out, the later we can start to be involved with getting that, the thought is the better off we may be in the long run. So.
And to answer your quick question on the helmets do not prevent concussions. There is no question about that. Helmets are there to prevent skull fractures and brain bleeds. You obviously want to be wearing your helmet. It can help lessen the risk a little bit, but they do not. So if anyone who is selling you a helmet, because I can't tell you how many parents show up and say that a concussion-proof helmet, it's the best helmet on the list, they've proven there is no proof that any one particular helmet is any better than the other right now, especially football-wise.
Okay.
But you just want to make sure it fits well so it helps prevent other injuries.
Does the same go for mouth guards? You're just protecting your teeth? Or
yes, mouth guards, they have
concussion
that myth has
prevention.
been debunked, that mouth guards do not prevent concussions.
Great.
There's no data that prove it does.
But if your
right
parents
now.
spend a lot on your braces, you still
Oh,
have
absolutely.
Absolutely.
For teeth, I'm a big fan of mouth
Yeah.
guards for every other reason.
I want to wear one every day.
Absolutely,
But yeah.
jaw and teeth.
And then, so you had mentioned that there's still a lot of kind of data outstanding in terms of the long-term effects of concussions, but Sarah's wondering if there is even a percentage number of people who suffer more than one concussion, and is there a correlation between kind of degenerative brain disease later in life?
There are some studies, well, I wouldn't go degenerative brain disease, but there are studies out there right now that show if you have had 2 or more concussions, your neurocognitive abilities can be decreased in adulthood.
Okay.
Now, they can't necessarily say exactly which part of it, whether it's executive function, whether it's just memory, but they say if you've had 2 or more, there are some studies that show that. There are other studies that show people with 4 concussions don't have any. So we're still working on that.
Okay.
And as far as the CTE, which is probably what they were getting at, they're still studying to try to decide. They know head trauma plays a role. We're just trying to figure out whether it's a concussion, whether it's subconcussive blows, whether there's a genetic component, whether there is an environmental component. So there's a lot of things going in. So that the jury is still way out on that one, I think.
On
but
the
science
effects.
is really starting to come along now. There's a lot of studies going in with the football.
Great.
NFL football going on. So.
And then if our child suffers multiple concussions, what is to prevent them from taking behaviors of some of the NFL athletes that was some correlation to some suicidal thoughts later? Would that be the same idea, that some of those changes?
That's CTE that they think is causing that, not just a concussion.
Not just the concussion,
and,
okay.
You know, again, there's no steadfast rule on concussions and how many you can have, but I think a good rule of thumb is that if somebody has suffered multiple concussions, a second or a third, and the recovery time is starting to become prolonged. So they had the first one, they were better in 7 or 10 days. They had a second one, it took them 14 to 21 days. They have a third one, it's now 3 or 4 weeks. And that's probably a good indication that whatever sport it is they're playing, whatever it is they might be doing, we need to reevaluate, we need to look at that. Because, you know, that's a bad thing. And like Kathy said, you could have somebody that has 4 concussions over a 4-year period that all get better within 3 to 5 days, and there's never a problem. And that's the scary thing about it, is that we just don't know.
Okay.
Or the ease, to speak to that too, just to add, the ease with which they happen. That's another thing the experts use. In other words, if your first one was a football or collision, your second one was a car accident, your third one is you bumped your head on the cabinet, and your fourth one is you moved your head out of the way of a ball really quickly, and that's a progression I've actually seen happen.
Gotcha.
They say when they start to occur much easier, with much less force, then that's when you start looking and saying, you know what, maybe we need to look at what you're doing and decide whether this is smart. Now, not all people stop playing the sport they want to, but they kind of assess the situation and say, what's the goal, what the risk and benefit analysis, which I think is always a good idea.
A good idea, yeah.
Always.
Yeah. Great. Well, that's it. You passed, both of you, the lightning round.
Thank you.
Excellent. Any parting thoughts or anything we missed that maybe we want to make sure people are aware of in terms of the services you guys offer? I think we kind of touched every base.
No, I think we have hit most. I think just, keep in mind that no matter what high school you are at down here, you do have an athletic trainer within your high school. All of our high schools have them. We provide them to 10 area schools.
Excellent.
So you always have an injury prevention, but also someone there to help medically manage any injuries that occur within the sports
And if they do they have to be, does the student have to be participating for a team to get access to the athletic trainer, or if it's someone who likes to play soccer on their own and injures themselves, like do they have access to the athletic trainers?
They can usually go in and ask questions. Most of the time the athletic trainers work with the athletes that are part of the school's extracurricular activity program. But most athletic trainers I know are not going to say, I'm sorry, I won't talk to you or help.
Okay. Great.
A lot of it's the education component.
Yeah.
I think that's the key thing is a lot of prevention stuff is really education related. So it's either getting a hold of us to get the proper education that you may need to prevent whatever problem it is that you feel like you're starting to develop, or contacting one of our health providers and coming in and getting a visit if you feel that you have an injury that might be work related. But early reporting of any injury is really a key. Okay. Because it's the injury that goes on over a period of time. It'll go away. It'll get better. I've had it before, and then it gets to a point where now you've waited so long that some simple changes in simple education isn't going to be enough to help to prevent or reverse the curse, as they say. Okay. So you really need to report those things early and get them taken care of right away.
Great. Kathy Thornton, Joe Scott, thank you very much for taking an hour out of your busy schedules to come on the show tonight.
Thank you for having us.
It was really great.
Thank you.
Thank you. So everyone just remember from going forward, if you're listening to the show tonight, every hour while you're at work or at home, if you're in the same position, get up, stretch, reverse those muscles. It's good for mind, body, and soul, I actually believe. Josh, thank you for another great show. Hannah, we'll see you next week. And stay healthy, South Coast.
By the time I graduated high school, I think I was between 275 and 300. I had to buy my dress clothes at the Big and Tall store. Enough is enough. Southcoast Health gave me the tools, and here I am, with my health. And I was a 46 going into 48, and now I'm a 30-inch waist. I'm living proof to show if you put the work in on anything that you can get what you want. Take impossible, throw it out of your vocabulary.